From the News Channel 5 Network, this is OpenLine.
Well, good evening and welcome into Open Line. I'm Chuck Long, glad to be along with you for the next hour. It is time to Ask the Expert, and tonight we're talking about endodontics. And I know a lot of you will have questions. We've had these guests on before, and you know, a lot of times you're sitting out there when you're thinking about a root canal. What is the process? How do you know if you need one? Should you be concerned? All of these questions that a lot of people have. This is your form, and as always, all you have to do is pick up the phone and call 737-7587. Give us your call, give us your questions, your comments. We'll get to them as quickly as we can. We're going to welcome our special guest tonight. Great to welcome you back, Dr. Horwat and Dr. Sandlin from Bluegrass Endodontics. Great to see you guys.
Thanks.
Thanks, pleasure to be here.
Now, one of the things, kind of just kicking it right off, we're talking about, you know, when you go to see the endodontist, you're talking about root canals, saving a tooth, chipped tooth, infected tooth pulp, those kinds. This is not just your general dentistry. This is the specialized, that kind of thing. What is the number one reason, I'll start with you, Dr. Sandlin, that people come in to see you guys?
Well, generally the process gets started at the general dentist when the dentist says, I've noticed some symptoms, I've noticed some problems. I think you need to go see a specialist to have that taken care of. So generally patients don't just look us up in the phone book and say, I think I need or want a root canal. They're usually directed. So.
And tell me a little bit about the business as well. So you started this in 2012?
2012 in Hendersonville, and that business has grown. We've had some great success there. And then earlier last year, we had the pleasure to bring Dr. Horwat on board, and we've also opened a second office in Mount Juliet.
Okay, so you've got two offices, and you guys are in both offices kind of on a rotating basis. So, Dr. Horwat, tell me, what brought you down to Nashville?
Geez, yeah. I was practicing general dentistry in Maryland for about 6 years, and then I went to do my residency. I visited a friend came to visit me, and he had, I haven't seen him in a long time. He had mentioned he lived in Brentwood. He talked Nashville up pretty well. I came out here to visit a friend, and then I just kind of, whenever I'm going on vacation, I'll visit different endodontic practices to kind of watch how they do things, cherry pick their best ideas, watch how they utilize staff, things like this. And then, you know, over time, I kind of visited a few times, and I thought that this would be a good place to raise my family. I thought this was the place to be.
Well, we're glad that you're here. We're glad both of you guys are here. And as we started at the top of the show, don't forget, just 737-7587. As you're watching, you come up with your questions, your comments. Again, just give us a call. We'll get to those as quickly as we can. We'll go through some of the questions at the top of the show. We talked about one of the number one reasons that people visit the endodontist. But what has changed about root canals? I mean, in the last 10, 20 years? Because I know at one point, someone said root canal, and it's like, oh my gosh, I'm going to be out for a week. This is going to be a nightmare. Is it still that situation?
It shouldn't be.
Okay.
And generally, and I agree that root canals have a tortured history.
Mm-hmm.
If you look back at the history of how some of these endodontic procedures were tackled, it does seem a little torturous. In the past 2 or 3 decades, there have been some amazing advances, namely microscopic. With the increased visibility, we've got the ability to look into the canal or the chamber and find things we couldn't see before. Advancements in materials, namely nickel titanium rotary files, allow us to engage these canals, achieve a nice consistent taper, increases the speed of delivery of services. What else? Electronic apex locators allows us to measure with a high degree of accuracy the lengths of the root, so we're not blindly coming out the end of the root.
They've also advanced it with digital radiography. Dr. Sandlin has a cone beam X-ray system in there, and I'm pretty confident that'll be the future of where our field is going. Not many practices have the cone beam technology, and it allows us to kind of climb 3-dimensionally down inside of the root. And even when we're in a practice together, we almost try to find excuses to just use the machine, just so him and I together can kind of look at it and pick each other's brains and just kind of look at things like that with regard to that respect as well.
Well, we'll talk a little bit more about that in detail, but right now we're going to go to the lines right now. Laura is on the line with us. Thanks for calling, Laura. Do you have a question or a comment for Dr. Sandlin or Dr. Horwat?
Well, I have a little bit of both. I'm one of those that had a root canal when they first started coming out, and I kept telling the dentist that I kept having electrical shocks through my tooth, and they said, no, the root canal, it's a root canal, it's dead, there's no reason. And of course, I'm 53 years old, and this was when I was in the 7th grade, and they kept saying, no, the root's dead, there's no pain whatsoever. And well, no, I keep having pain in that tooth. And they said, no, there's no way. But anyway, now, later on, I've got the crown on and everything, and no longer have any problem. But I have a lot of problem with periodontal disease and everything. But I have 4 other root canals in my mouth. But the last couple of weeks, they are very sensitive to any cold or hot. And I have fibromyalgia. Is there any relationship between the periodontal and the root canals and that would cause pain?
Okay, let's take that.
Well, there are a lot of potential issues at play there. Periodontal disease, root canals, crowns. Fibromyalgia is an exacerbator of just about everything. So that's kind of a wild card. There were a number of questions in there. One of the things that kind of jumped out at me was root canal teeth that have recurring sensitivities to temperature. And of course, the best way to know for sure would be to come in and have an endodontist or your general dentist do some tests, take some radiographs to see what's going on. But the likelihood that root canal teeth are still suffering from some sort of temperature-related issue is very slim, and that has to do with the nature of the way the body perceives temperature, and it can be very misleading for the patient. You can be quite certain it's one tooth, and we come in and verify to you in the chair that it's actually a tooth in front or behind. So that was one of the things I picked up on.
Yeah, and that's a common thing that we get a lot. You know, a lot of times you finish a root canal and a patient will come back in and they'll tell you that it still has temperature sensitivity. And Dr. Sands right. It almost never is that tooth. Chances are something else is going on, and your brain's doing the best they can to process information. And he's right. This one's there's multiple variables at play here. You got the fibromyalgia, you have the periodontal disease. And from my experience with fibromyalgia, from patients and talking to people, the neuropathologists and people like that, that's a wild card. I mean, the amount of things that can cause that's another thing where the brain's trying to process information and it just can't really figure it out. You know, I wonder sometimes if the clinicians just can't figure it out and say, oh, it must be fibromyalgia. And it's just more or less kind of a universal term. It's not exactly the case, but it does get a little bit confusing when you throw that in there. She should go back to see her general dentist or an endodontist and just try to rule out some type of nerve pathology. But usually when they're sensitive after a root canal, something's definitely wrong. You're going to want to go to your general dentist.
Go and check that out.
Yeah.
Okay, well, Laura, I hope that helps out.
Thank you.
Okay, thanks so much. Have a great evening. All right, we're going right back to the lines. I think Maria is on the line with us right now. Good evening, Maria. Do you have a question or a comment for us?
Yes, I'm Puerto Rican, so I'm sorry, my English is not good.
Okay.
I'm 70 years old, but I've never been in a dentist, and I have all my teeth, but one of my teeth is growing. It's crazy. And I have to file it down with the thing that I file my nails. I filed it, and eventually they went down, but it's growing again. Is it very bad, very serious to do that? Only one tooth.
Okay.
That's because my tongue was catching in my tooth, and I got real sore tongue for a long time. And I said, oh, what's happened? And then I know the tooth was growing. It was catching my tongue.
Okay, well, let's take that.
Well, 70, the tooth is most undoubtedly reached its final dimension. And as one that's gone on mission trips, especially into some other countries where I've seen some hygiene situations where the calculus can build up to where it almost appears as if it's a separate cusp of the tooth. So my guesstimate would be that it's probably calcium or tartar type buildup on the inside that just feels like it's part of the tooth.
Okay.
Oh, so it's nothing that I'm going to die from.
No.
Okay, well, thank you.
Okay, Maria, thanks so much for calling in, and we understood you just fine, so we appreciate the call. All right, we are going to take a break right now. There's going to be a lot more questions when we come back. And don't forget, as always, it's your forum, 737-7587 here at OpenLine. We'll take a break, and we'll continue right after this.
I didn't even...